Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board-certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun. Hey guys, do I have the show for you today? In this month of November, I know there's going to be a lot of preparing turkeys, preparing for the holiday season, and preparing for surgery, because as we know, December is busy season in plastic surgery. And I thought, what a great opportunity to feature one amazing plastic surgeon that has been on my radar, and that's Dr. Richard Brown out of Scottsdale, Arizona. Hello, Dr. Brown. How are you?
Good. How are you doing?
We're doing good. I'm so excited to have you on the show. I can't wait to just dive into all of your expertise and for you to help my girls get ready for surgery. So for this episode, I thought, let's pretend our patient is 3 months out from their dream surgery, a mommy makeover, or a facelift. What can they do to get ready?
So I do mostly breast and body surgery. So that's a great question. I think the first thing that people should be thinking about leading into surgery is their body in the best place to receive the best result, right? So when it comes to body contouring surgery, we want to know that people are in the healthiest place they can be in. They've maximally lost the weight that they're trying to lose. And it's not just, I love to tell my patients this is not a fat versus skinny thing. When it comes to something like a tummy tuck, if you carry too much fat internally around your organs, we call that visceral fat that pushes out on the muscles, you can't get the best tummy tuck result. So I think what people should be honed in on, I'm really passionate about plastic surgery should be your last resort, which means you should be dialing in your mental health and your nutritional health and your fitness health well before surgery. I think that's the number one thing that people can do to get ready.
Absolutely. So you touched on something so important that actually not very often gets touched on, which is mental health and how that really plays into this whole industry for us. Why don't you elaborate?
Yeah, it's huge because if your mind is not in the right place to receive the surgical result that you're going to get, then you're never going to be happy. So I have a mental health specialist in my practice that I can refer patients to. When I identify that someone either has a poor relationship with food or a poor relationship with their body image and they're seeking plastic surgery, I know that I could give them the best physical surgical results on the planet. But if their mind is not in the right place, they're not going to see that result in the mirror mentally because they're just not mentally in the right place to accept it. So I think that patients honing in on their why they're doing it and what it's going to do to add value to their lives. And is this the right procedure for them? Are they in the right time and the mindset to do it? Really understanding what their goals are is paramount to their being happy with whatever result they get.
100%. I can't emphasize that part of it more. Before, when I was working with plastic surgeons and we were in the office and I would see patients, I saw to some extent, patients come in with post-op blues and maybe a little bit, this could be a little bit better or something along those lines. But it wasn't until I launched this podcast and I started to speak to women from all over the world and from all types of surgeons, amazing surgeons to shouldn't have let him do surgery on you surgeons. And a lot of them have that same complaint of the emotional roller coaster that they're going through before and after surgery. And until I left and I was more exposed to more, I didn't really understand it like how I do now.
Oh, yeah. And I mean, we touched on the aspect of your mind being in the right place to receive the best result. But then there's the part you're talking about, which I wrote about in my book, the whole post-surgery blues thing, right? So when you ask me what could other people be doing prior to surgery to get ready, it's not just about mental health. It's also about you're a mom, You have kids. You're used to doing stuff with your kids and taking them here and taking them there and things around the house. And maybe you have a job too, and you're shuffling all these different things. I tell patients, you have to, before surgery, get all of the things in place, like freezing lunches and putting them in the freezer and knowing that there's going to be someone there to help get your child to this event or that event. Setting all of that stuff up prior to surgery allows you then to appreciate that you have taken the time to do something for yourself, and you can recover properly without having to worry about painting toenails and braiding hair and taking your son to baseball or whatever it is, So I think setting up preoperatively who's going to help you while you're recovering allows you to then recover and appreciate that you did something great for yourself and you don't stress. That's a huge thing.
Absolutely. I like to tell my girls, meal prep, if you're recovering at home, because there's two different types of recovery, right? The recovery where they're at a recovery house or with the private nurse. And then there's our moms who go recover at home with their families, and maybe somebody comes in to help them, a mom or a mother-in-law or a husband who help them through that recovery. But with both ways, but especially when you're recovering at home, meal prepping and preparing everything, anticipating what you could be needing in the following 2 weeks after surgery can relieve so much stress. When you're in recovery, you just had an abdominoplasty or you just had a full body liposuction, and you really can't get up and move very quickly. And you are realizing, oh, I have to go get birthday presents for this, and I have to go get more diapers, and we are out of baby wipes and all of these things. So preparing ahead of time just saves you so much stress, so much angst.
Yeah. And I mean, that post-surgery depression is real. It's real. I mean, I call it post-surgery blues. I hate to say depression, but you've seen it, right? Like, it's definitely a phase that women go through when they're recovering, where they get this guilt and remorse for doing what they've done because, oh my gosh, I'm not available to help do all the things that I'm normally doing. So I think tackling all that beforehand and coming up with a solid plan to handle all that stuff for you and your family is a great way to go to be able to put yourself in the mindset postoperatively to just be happy.
Dr. Brown, you touched on something very important earlier in our conversation about the lifestyle changes and how plastic surgery should be a last resort. Why don't you go a little bit into that?
Yeah. So I, truly believe that cosmetic and reconstructive plastic surgery has its place. I wouldn't be doing this if I didn't believe in it. We hear all the people say, why can't you just love yourself? Why can't you just be who you are? We all know you can't exercise saggy breasts back to being perky. That's just not possible, right? And everyone wants to look and feel their best. But I think the things that I was talking about is that nutritionally, you need to be in a good place so that you can heal. You need to be exercising and working out because that increases blood flow to the tissues, and it's just overall good general health for the tissues. But more than anything, what I alluded to is that when we do tummy tuck procedures, I'll see a lot of patients who come in and the goal is they want the loose skin gone and they want to be as flat as possible. Well, a lot of times patients come in and they're like, oh, but I diet and I exercise and I eat well, but I just can't lose this extra weight. And they come in and they've kind of got like that bulging of their abdomen from the inside where all the organs are. And so the reason that it's so important to help them, I have a nutritionist in my practice too. So when I identify that people are struggling and their plan's not working, I go, listen, before surgery, I want you to go work with Megan. She's a nutrition consultant. She's going to identify the things that you think you're doing well and help you fix those. And the things that maybe you aren't doing that are keeping you from getting to the final goal of losing the extra 5 or 10 pounds or whatever it is, she's going to work with you. So I think getting the nutritional part intact, not only does it help you prepare your body to be in the best place to obtain the best result, but guess what? It also sets you up so that postoperatively you can maintain the results that you've been given. Because if you don't have the lifestyle in place before surgery, you're certainly not going to have the lifestyle in place after surgery. And a lot of those patients rebound in a year and gain 20 pounds back and they're unhappy.
And then they're in the office and they're saying, "Oh, the liposuction didn't work. The tummy tuck, it never looked right from the beginning."
100%. Like, it's so important. It's such a big thing that I'm trying to talk about on social media and just put out into the universe on my social media platforms that, people really do have to partake in their ability to get a good result.
Oh, 100%. I think I've mentioned it on the show before and we've talked about it, where I'm like, the habits that got you to the place where you're at the plastic surgeon's office asking for a procedure are not going to be the same habits that keep you with the results that you get. So if you are continuing to consume alcohol excessively, if you're continuing to consume excessive calories, if you're and not exercising, no matter how much liposuction is done or what your skin is removed, your results will not look the same if you continue to eat and continue to gain weight after your surgery. They're not going to look the same, no matter what.
They'll change and you're going to yo-yo. And that's what I like for people to alleviate the yo-yoing before they decide to make this big decision to spend a ton of money on having a body contouring surgery. Like, we don't want you to yo-yo. We want you guys to be successful. And I think a lot of patients have this notion that surgery is going to cure everything. It's going to fix me and I'm never going to have an issue again. And I'm like, no, it's going to be hard work no matter what you do. It's going to be hard work to prepare for surgery, and it's going to be continued hard work after surgery to maintain your results. But I mean, that's why if people can really focus on dialing in that lifestyle beforehand, it's easier to maintain after because they're just already in the habit of doing that. And I really, really want more offices to focus on the mental health and the nutritional aspect. It is so important. I'm actually creating a wellness center concept that centers around providing this for patients. And I want to disrupt our industry such that more plastic surgeons are in the habit of saying, hey, I don't just say yes because I want to make the money and do the procedure and do a good job. I want to say yes because I know the patient is in the right place at the right time to get the right result, and then they're going to be happy forever. Like, we want more people to be that way.
Dr. Brown, I could not be more in tune with your message because actually, after launching this show and seeing so much more, I bumped paths with a company that's what they offer, services for after plastic surgery procedures with nutrition and mental health coaching. They do all genetic testing to make sure you're really healthy enough for surgery and prepared. So I'm hoping that together, there will be some disruption to the industry and there will be more talk about, should we be doing these procedures? Has this person had enough surgery? Like, should I turn her down?
Yeah.
And I think that question, sometimes, a lot of times, they should be turning patients down, but they're not.
Yeah, 100%. I'm happy to lose a patient who wasn't a good candidate. And if they want to go down the street and just find someone to say yes, they can do that. But you know what? A lot of times they end up coming back a year or two later saying, I went to so-and-so, I did this, it didn't work. What do I need to do to get fixed? So I think it's worth investing some time and some effort into your personal well-being before surgery so that you can be successful and have an amazing result.
You know, Dr. Brown, I wonder if tell me what you think about this. You know, mainly the patients that you're seeing are moms, right? And a lot of the time, moms, myself, I know this was definitely the case for myself. After I had my kids, it was just all about my kids. I was just 100% like blinders on. If it had nothing to do with my children, I'm not interested. And that had to do with myself as well. Like, I wasn't taking care of myself the way I should have because for reasons of maybe societal pressures of like, okay, now you have children, you have to be 100% devoted to your children and you cannot be, about yourself and have your own life and think separately. It's a lot of societal pressures of no, it's about them. And when I launched this podcast and kind of started this whole process and this whole mission, it was a little bit of reclaiming my independence and reclaiming my autonomy from not just being a mom, but being like a whole person. I need to take care of myself in my thoughts and my what I feed myself, all of these things that I had before not thought about.
Yeah, I agree. I think for you guys, moms, after you have kids, there's this maternal instinct to just forget about yourself and focus on the little cubby bears because that's what you have to do. But, you also forget that if you're not in your best place, then you can't show up for them 100%, right? So if you're not feeling good and you're not taking care of yourself, it's really hard to be there for them in the best way possible. So I'm glad, I'm happy for you. I think the way that social media is today, I'm glad that this is talked about a lot more, because I think probably a lot of women forever felt the same way, but no one was talking about it with each other. And now it's like, oh, you felt that way? Yeah, I felt that way too. Oh, so it's okay for us to like take care of ourselves. Like we need to start doing that and talking about that. And that's great. I'm glad you've come to that revelation, because I think that moms do tend to put themselves last a lot.
And with that revelation, I also had this empowering phrase that I'm like, you know what? It's okay to invest in myself. Because another thing is that there's guilt. There's a lot of guilt involved. Am I guilty for spending all this money on myself? I could be paying for college. I could be, doing some remodeling to our home, or I could be taking my kids on a vacation. And that mom guilt, it's not easy to get away from it. Yeah, so invest in yourself was kind of like this, I'm worth the investment. Yes, we could make those changes to our house. We could take the kids on a vacation, but I'm worth the investment too. We can spend this money on me. It's okay. And I think that's a mental barrier that a lot of women go through.
I think it's good for your kids to see that too. I think it's good for your kids to see that you're going to put yourself in front of certain things because you're important. And I think that then maybe hopefully allows them as they get older to go, I'm going to do the same for myself when it's appropriate,
That's an interesting topic you touched there too. So what's your opinion as to when women are having surgery and they're having conversations with their kids? What should they say?
My wife and I tend to be an open book about things. Like my boys watch my surgeries. They're like, what are you doing today? PBL, lipo 360? Are you doing a tummy tuck? Like they ask me what I'm doing. It's hilarious. But I think that it's important to not shelter your children. Obviously, there's an age here at which it's appropriate versus not appropriate. And when they're a lot younger and they might see mom have an owie, it's like, hey, mommy was fixing something that, was that she didn't like, or, not having to give them the full details. But I think it's okay to tell your kids, like, listen, we grow up, we age, we change, our bodies change. There's things that we can do to help ourselves feel and look our best. And that's what I'm doing. I think you just have to be upfront with your children, and everyone's kids are different. So I don't know when it's appropriate for who, but with our boys, my boys are on the spectrum. Like we didn't shelter autism from them. We talk about it. We make it well known that they're on the spectrum and what that means, and how that makes them different and not different. And I think it's just important to be honest with kids, because kids are so much more understanding than you ever know. You don't have to give them the graphic details, but I think it can be explained in a way where they go, oh, cool. Kids are so oblivious. They're like, oh yeah, cool. I get that. Great. Thanks, mom. That's awesome.
It's so true. Okay. So now let's say we're 3 months away from surgery and we're making lifestyle changes. We're making lifestyle changes by starting to maybe include some daily walking, at least. If you don't have a full gym workout, if you don't have a full 1 hour to dedicate, at least walking 30 minutes a day will help you get ready.
Huge.
Okay. And also let's talk about eliminating alcohol and smoking. Because women want to know, when do I have to stop drinking?
Yeah.
When do I have to stop drinking alcohol? But they don't like hearing 3 months from surgery or 2 months from surgery. They want to hear like, oh, just 3 days. 2 days, you're fine.
Exactly. So let's take these two separately. I mean, I don't really drink anymore. So it's so funny because I used to be such a big, heavy drinker in college and thereafter. But my wife and I just don't drink anymore because we love to work out. We love fitness. And I can't stand it just makes me feel like crap. I can't sleep. I'm sweating all night. So I don't drink that much anymore. So you guys, I'm not anti-alcohol. I don't like to tell people they shouldn't drink, but I do think cutting it back for several reasons is important. And I'll give you the timeline. One, cutting it back because it's just a horrible source of caloric intake. If you're trying to lose weight, you're literally chasing your tail with alcohol. Like you're drinking your calories. And I think just by cutting that out, you can lose the weight. When should you stop? We talk about red wine and the tannins and all that, thinning your blood. I generally tell people you might want to lay off of that 7 to 10 days out of surgery. I mean, there's really no scientific evidence that we can give people to tell them. But I think, if you're cutting back on the alcohol and you want to give yourself the best opportunity, give yourself 7 to 10 days. of maybe not drinking and just let your body get prepared for what's about to happen. And post-operatively, obviously, when you're taking medications, you shouldn't be drinking at all. But again, for post-operatively, I would tell people maybe give yourself a few weeks before you think about drinking again, Usually their body will know. And if you feel like you have to drink within 7 to 10 days of surgery and you have to drink within a week after surgery, then you need to look in the mirror because you probably have a problem, right? You shouldn't be that dependent on alcohol. You shouldn't be. So I like to try to have people kind of curtail that 7 to 10 days prior and then post-operatively, a few weeks. As far as smoking goes, do you have any questions about that? Do you agree?
Oh, I 100% agree.
Okay, cool. So let's talk about why is smoking a problem? It's really nicotine that's a problem. There's two issues with smoking. One is the pulmonary issue. You're going on the ventilator, right? And you're going to be on a ventilator. And if your lungs are stiff and you're healthy, you don't have healthy lungs, the risks of you having complications on a ventilator are high. So that goes for vaping or smoking. So that's one issue. The second issue is nicotine. Nicotine is a potent vasoconstrictor, or it tightens the blood vessels. It makes them small. So when you have a wound and we make an incision, we are relying on incredible blood supply to nourish those cuts and wounds to heal you. When you are using nicotine products, you literally cut off the blood supply to your wounds and they won't heal. Anyone who's ever met a type 1 diabetic knows that they have a really hard problem healing their wounds on their legs or anywhere on the body. Why is that? Because chronically high blood sugar damages the blood vessels, the tiny little microvascular blood vessels. So they can't heal wounds either. So it's very similar to having diabetes. So people who smoke, I make my patients quit smoking 6 weeks prior to surgery and 6 weeks after surgery. It could be a month. It could be 6 weeks. Probably either one of those is fine. Inside of a month, I think is a really bad decision. I nicotine urine test everyone at their pre-op 2 weeks prior. I nicotine urine test everyone the morning of who has a history of using nicotine products. And if they are positive, they get canceled. I am unwilling to take someone to the operating room knowing that their risk of having wound healing complications like nipples dying, tissue turning black and falling off. Like when you put it that way to patients, they're like, oh, well, I don't want my nipples to turn black and fall off. And that is literally what can happen from smoking. So I tell people 6 weeks before, 6 weeks after, at a bare minimum is what you need to be doing.
100%. So, and what about THC?
There's really not a healing component to that. So a lot of anesthesiologists will tell you they can tell when patients are chronic THC users because they require a lot more narcotic medication. They take a lot more to kind of to relieve their pain.
Put them to sleep.
What's that? Yeah, exactly. But it really doesn't affect their wound healing, to be honest. I mean, again, the smoking part is the pulmonary issue. We don't like people to have stiff, diseased lungs on a ventilator because it's a problem. We can't oxygenate them well during surgery when their lungs are stiff and we can't transfuse oxygen across their lungs. So that's the biggest issue. But as far as THC in general, it's not going to prevent it. It doesn't cause wound healing issues. It's not like nicotine.
So what about patients who want to use it for after surgery to control pain?
Yeah, I'm on the fence about that. I mean, I don't know that it really does control pain. We hear a lot of people talk about it. I'm not really sure we have clear evidence of that. Will it hurt? No. I mean, it's not going to hurt. But what you do have to be careful of is if they're taking benzodiazepines and they're taking narcotic medications. So we've given them some muscle relaxers, Xanax type medications. We've given them Percocet or narcotics, and then you're going to add marijuana or THC to that. Could be a sedative as well. That's where it becomes dangerous when you start mixing
combining
with drugs that are sedatives. You can stop breathing. That can kill you. So that's where the problem comes in.
Absolutely. Thank you for clarifying that, because they like to hear, yes, everything's good. You can take your gummies.
Yeah, I mean, look, I hear you. I think it's great. People do what they want to do. But again, if it's something that you can't stop for 6 to 8 weeks completely in your life, then you have to look in the mirror. It is a problem, right? You should be able to stop doing any of those things at any moment in your life when it's not safe and not necessary, and be okay with that.
Absolutely. So, Dr. Brown, why don't you tell us, if you have a patient that's coming in to see you and they have surgery, for example, in 6 months, and they want to do everything they can to get ready, what's something that they could do? I like to recommend to get their labs checked.
Well, I do that for everybody, actually. So I don't follow the American Heart Association guidelines. I don't care how young or how old they are. Everyone gets a set of labs. They get a CBC. I want to make sure they're not anemic or heavy menstrual cycle bleeders, because some women, I'm the first doctor they see, right? If they're in their 20s, maybe they even haven't been to a female health specialist in their day and they haven't had labs drawn. So everyone for me gets a CBC or a complete blood count so we can look at their hemoglobin, make sure that's good. I get electrolytes on everyone to make sure their sodium and their potassium and all that's on point. And believe it or not, even in young people, I send them for an EKG. An EKG is a cheap test. It doesn't cost a lot. And every now and then you will catch someone with an electrical cardiac issue who was otherwise healthy and didn't know about it. And you don't want to find out about that when they're asleep on the table. You want to know about that before surgery. So, I'm not recommending that everyone goes out to do that stuff. You should follow the guidelines of your surgeon. But if you know that you tend to be an anemic person and you're getting ready for surgery, well, maybe talk to your female health specialist about putting you on some iron so that you are not anemic leading up to surgery. There's things like that you can do. And then just being nutritionally sound leading up to surgery is huge.
Elaborate, because we talk about that so much on here.
Yeah, look, protein is important, right? Carbs, fats, and proteins are all important, but you need protein to heal. We need collagen to be laid down in wounds, and you don't want to be starving yourself and being nutritionally depleted. You don't want the way that you lose weight leading up to surgery to be because you're starving yourself, because then you are nutritionally depleted. Then you could potentially have electrolyte imbalances. If your potassium's off, you could have heart issues during surgery. So you just want to make sure that you're eating really well-balanced meal plans. Yeah, you can have some pizza and some of the bad stuff too, right? Balance is everything. But I like the 80-20 rule. I think 80% of the time trying to eat a really healthy, balanced diet, maybe 20% just enjoying your life is great too. But I think if you go into surgery, because right? We all know, those of us, I was heavy, I was overweight, I was obese when I got out of residency. I felt like crap. My joints hurt. My knees hurt because I was carrying weight around. I couldn't walk from here to there because I couldn't breathe from carrying all the weight. And then when I lost weight, I was like, oh my God, I feel amazing. You just feel better. So why wouldn't you want to go into surgery feeling the best that you could feel? Because that really sets you up mentally for a good recovery too. Not only physically, but mentally, you're like, man, I'm in the best body I could be in leading up to surgery. I'm going to kill this recovery and be good to go. And that's where you want to be.
100%. Because if you could quantify the percentage of how much better they do during recovery, what would that be?
It's hard to say, but I'm going to give you an example. So I had a total hip replacement 9 months ago. And one of my coaches at CrossFit just had a total knee replacement 2 or 3 weeks ago. He is already back in the gym, coaching people in the morning, walking around, doing his physical therapy, that type of stuff. I was literally back on the jiu-jitsu mat and back at CrossFit inside of 6 weeks. I probably could have gone back sooner, but I didn't. The fact that we were in such amazing, healthy shape prior to our surgeries is a testimony to why our recoveries were flawless. My hip replacement surgery was flawless. By 6 or 8 weeks, by 6 weeks, I was back at CrossFit doing body weight stuff. I was back on the jiu-jitsu mat doing some light type of rolling and just gentle movements. And by 3 months, I was full on doing whatever I wanted to do. And that is really because I was in incredible shape before my surgery. So the better in shape you are prior to surgery, the better healing process you're going to have. It's hard for me to quantify a percentage, but I can tell you in my practice, the patients that I see that roll into surgery healthy, which is most of my patients because they know that I'm passionate about that, they have really flawless recoveries. They might be in pain, but they really recover well and heal well.
Less swelling. I almost feel like less swelling, they have more tolerance for pain, less anxiety. Also, I feel like they're also less anxious.
Yeah.
I don't know if maybe it's something about that workout ethic.
Oh, yeah. Sometimes I have trouble holding my patients down. They're like, when can I start running or walking? And they're like, just had a mommy makeover and it's week 2. I'm like,
not yet.
Pipe down, sweetheart. Give me some time. Let's get you to recover. But you're right. Those people that are antsy to get back to it, I love those patients. Those are my favorite patients because that means they're itching to kind of continue what they were doing beforehand, which is an awesome place to be.
And wouldn't you agree also them getting back into their normal routine pushes off any post-op blues?
Yeah, for sure. I think it's inevitable that people are going to kind of feel regretful after surgery
Oh
sometime.
yeah, that, buyer's remorse, that
But
first.
this is why doing the work prior to surgery is so important. If you really set yourself up before surgery to give yourself the grace to appreciate that you're doing something for you and you are important enough and you are worthy and you are valuable enough, if you can make yourself believe that prior to surgery, then the post-surgery depression is not that great. And then if you have a good partner to help you post-operatively or someone in the family to help you with the kids post-operatively where you don't have to stress about that, it's easy to avoid the post-operative blues, in my opinion. But yeah, I can't speak enough to being healthy prior to having any surgical procedure.
Any back surgery, shoulder surgery, hip
all of
surgery,
it.
knee surgery, anything.
You don't know how good you feel until you feel good. Like you don't realize when you're in a state of unhealthy, you think you feel good and you're good. And then you maybe start making changes and you lose a little weight or you cut out drinking soda, you get rid of some of those inflammatory types of foods and you start to feel good and you're like, holy cow, like the clarity in my life mentally, my gut doesn't hurt, my joints aren't hurting as much anymore. It's amazing when that clicks for people and they get that transformation, then they really become addicted to health and wellness, which is awesome.
That it's something similar to that happened to me when I was working at as a patient coordinator, I was working at a very busy practice with 2 surgeons, and it was very strong, fast-paced environment. And I didn't realize how stressed I was from my work until I stopped working at that and I launched all my own stuff. I realized my hair got thicker. Oh, I was losing my hair. And then I started to realize, oh my God, my skin is clearing up. All of these different things. I must have been really stressed out and I just didn't realize it.
Yeah, stress is crazy. I don't want people to think or believe that there's a way to eliminate it, right? It's impossible to eliminate stress, but mitigating it or recognizing it, and slowing down when you need to slow down. I mean, those are all things that will help you with postoperative recovery too. Like just trying to take a deep breath. And I mean, life gets hard, right? Life is hard. Raising kids is no joke. It's not for the faint of heart. Just like, I get why some people don't have kids. It's a lot of work. It's a lot of work. It's a lot of work
for sure.
But they're awesome. I love them.
Okay, so now let's say we're 1 month close to surgery. Now we're getting closer. We're in crunch time. This is when they start to really think like, oh my God, do I have everything I need? Am I really ready? Do I have my supplies? They also start second guessing their surgeon. Did I pick the right one? I don't know. Now they start getting anxious and nervous. So what should they be doing month of surgery?
Those are all great points. I think that usually within 2 weeks, right? You guys do your pre-ops within 2 weeks. I think they should be preparing all of their questions, all the things they're stressing about, write it down so that when you come to that 2-week pre-op visit, you can ask a lot of those questions. So a lot of them will be answered at that preoperative visit. So that's definitely something I think that you could be doing leading up to. Number 2, as we've sort of talked about a lot, just making sure you're really being in the most healthy body you can be a couple weeks before, starting to think about recovery. Where am I going to recover at home? Where's going to be my spot? What books am I going to read? What am I going to do to kill time when I'm laying around? What am I going to have next to me for hydration? Like what's the device going to be I use to drink out of? Starting to think about what areas of the body am I having operated on? Is it going to be hard for me to get up or reach over to get this or that? Like think about everything. Like put yourself in a chair and go, I can't get up or reach for that. So where do I need to place everything? So start planning out your recovery zone is really, really good. And then when you said about starting to second guess your surgeon and all that stuff, that's normal. That's normal too. I think, again, bringing that to your pre-op is important. Like in my office, I don't meet with all my pre-ops. We give them the option to meet with the medical assistant or me. And a lot of them are like, oh, no, I'm fine. I feel like I've gotten everything I've gotten. At my preoperative appointment, I'm happy to meet with the medical assistant. And then sometimes like, you know what? No, like I have a lot of questions to ask. I'm really freaking out and I want to talk to my doc. And so I'll go in for those appointments. And I think being okay with telling the office, like, hey, I really, really would like to meet with the doc. I know that you guys do it this way where the MA is meeting with you or the PA, but I really have some questions and I need to see the whites of their eyes to make me feel better. Don't be afraid to ask for that. I know for me personally, I never get mad if a patient asks that. While I might be busy and go, like the pre-ops are for your day. Like I can't, it's so hard. We're doing so many things. I'm never going to balk and be mad if a patient wants clarification from me and confidence from me. Because look, if I don't give them that, then they're going into surgery with not the great mindset that they should have. They're going in feeling a little iffy and risky. And then their recovery, if there's even one little blip on the radar and something goes kind of wrong, they start falling apart. Whereas if they know I'm there for them and I was there pre-op and I answer all the questions they have, if something happens post-op and they DM me on Instagram and I message them back, they're like, cool, thank you for responding. Got it. It's not a big deal. I trust you. Noted. So be able to stand up for yourself and tell the office what it is you need to feel better.
100%. You touched on something that I talk about on the show all the time, which is sometimes every office is different and every surgeon does things how it works for them. But sometimes for patients, how that office does things might not work for you, because there's a lot of offices that don't have I'm going to give you an example, and I think you would be shocked. So there's this practice here in Texas that they're notorious for just chop shop activities.
Yeah.
And the way they do things, a coordinator calls you back, you send in your pictures, they tell you what surgeries you would be having. And then if you want to book those surgeries, then you pay a consultation fee and then you meet the surgeon. But no, you don't meet the surgeon. Then you meet the surgeon the day of surgery, the morning of surgery. You pre-op with somebody else. And if you want pre-op with the surgeon who's going to be doing your surgery, it's going to be 4 or 5 months from now. There's no way you're going to be able to get in there. So they're having you book surgery without meeting the surgeon, without getting your questions answered by the recommendation of whoever's looking at your pictures, the coordinator that you're sending them to. And unfortunately, they're busy. And unfortunately, they're busy. So a lot of people do get hurt.
That's a problem. This is crazy. This could launch us into a whole nother topic. Right?
I know.
But what patients are okay with that? That's what I want to know.
Let me tell you who. The patients that do not know better. They don't understand that they have options, that just because, and this is why I'm so vocal about it, just because they do it like that doesn't mean that you have to take that. You take your business elsewhere. You agree. Go somewhere where they treat you with the best respect, and you get to talk to your surgeon anytime you need to, not
100%.
push down for somebody else to have to deal with you.
Yeah. I mean, those places are clearly, it's about the numbers for them, and they're not really there for the quality of care. And I swear, it blows me away when I hear these stories. I'm like, it's your body. You only get one body. Please make sure you choose the right surgeon. I mean, we could talk about this. Like, how do you choose the right surgeon? And I always tell people that come to me for consults, I'm like, have you talked to anyone else? No, I haven't been anywhere else. I'm like, I encourage you to go meet 2 or 3 other people, unless you know I'm the one, and you feel awesome today about what you've gotten, like you should. And because the reason is, you want to be able to leave an office knowing that the person in front of you is, without a doubt, the person that you vibe with, that answered your questions. You didn't feel rushed. You felt good about the people that worked there. They all seemed to like the doctor. So that means he must be a good guy, or she must be a great woman. I mean, I really feel like you should be getting a general vibe that when you finally make your decision, there should be no question that they're the right surgeon. Now, some of those people end up getting botched or screwed up. That happens, right? Like, we make a bad call. They seemed like they were a good surgeon and I really liked them at the consult. That can happen, but it's so much more rare for that to happen. You're right, man. People need to stand up for themselves and go somewhere else. But how do they not know? I don't understand that. How do they not know that there are other options?
So let me tell you, it's the Hispanic community. And that also touches on a lot of the Hispanic community doesn't know to look for board certifications or what type of doctor is even supposed to be allowed to do this procedure, because we have this trust factor of like, we trust that if this place is open and they're doing liposuction and other people are going there, then they must be doing everything legally. Right.
They're legit. Yeah. I want to know when our country is going to come to its senses and shut down all of this accessory, like ER docs doing lipo in their offices or internal medicine docs. Some guy, a second year resident, sent me a video this weekend. He's like, hey man, how do you feel about this video? And it was like a guy doing awake lipo in the office, right? And I was like, oh, I've seen awake lipo like in the outer hip area isolated. Maybe I don't do that. I like my patients to sleep. I don't love that. But I'm like, what do you mean like about what he's doing? He goes, well, this is an internal medicine doctor.
It's a shame.
Like, oh my God. I'm like, people don't understand what board certification means. And that doesn't mean that you can't have a poor outcome from a board certified plastic surgeon, but at the very baseline, your surgeon should have passed boards by the American Board of Plastic Surgery, because at least then they've taken the test and passed it. They've taken the oral exam and passed it, and they're deemed at least safe enough, maybe not ethical, but they're safe enough to know everything about plastic surgery to give you a safe result. Now, that said, of all the board certified surgeons, it's then your job to determine who's good and who's bad, right? Because once they're board certified, they can still suck. But I really don't understand the choosing like a cosmetic surgeon because their website said they were a cosmetic surgeon, and that people just don't understand what board certification means.
You know, I've been very vocal about this, and I know I've even maybe put a little X on my back because of how vocal I've been about this, because of this cosmetic board certification and really all this word play of double board certified and triple board certified, and specializes in aesthetic cosmetic surgery and all of these different buzzwords that really just confuse the consumer, who now doesn't understand that this board certified plastic surgeon completed this much training to do the surgery that you are talking to them about, versus this cosmetic surgeon who did this limited amount of training to do the same exact procedure. And what I like to point out and just really emphasize is, okay, maybe he can do the liposuction, but can he identify if he did something wrong during that surgery and know how to go through the process of a complication? And maybe not even just with liposuction, but tummy tucks. There's some internal medicine doctors doing tummy tucks in their office.
I know. It's crazy. And you nailed it, right? Like, I mean, I don't want people to think I'm bashing. Like, any one of them probably technically could be an amazing surgeon. They could be an amazing surgeon. But what people don't realize is this, and I want your followers to hear this, okay? People will put cosmetic surgeon on their website, but they're board certified by, let's just say family medicine. They do not have privileges at any hospital to admit you for plastic surgery as a plastic surgeon because they aren't board certified. Hospitals will not allow you to be on staff as a quote plastic surgeon unless you're certified by the American Board of Plastic Surgery. So let's say now you have a complication that you need to be hospitalized for. That doctor can't even take care of you. They're going to say, go to the ER. They'll handle you. The ER doesn't know what they're doing. They're going to call the plastic surgeon who's on call to come take care of you. So what people don't realize is it's not enough that they're in an office doing a procedure. They're not prepared or equipped to handle the complications, nor are they allowed to even admit you to the hospital to help you because they can't get privileges. So, I mean, that's a question everyone should be asking is not, so when they go to see their surgeon and they see that they're a cosmetic surgeon, they go, what board are you certified by? And if they don't say the American Board of Plastic Surgery, they're not board certified plastic surgeons. That doesn't mean they're not good surgeons. It just means they didn't go through the training that we all went through to certify that we're safe, efficient surgeons that are certified to do what we were trained to do. I would never go do open heart surgery or deliver a baby, but I could.
Same thing.
You know what I'm saying? So why would you go to an ENT for a breast job? Now, I will say this. I think ENTs are more than well equipped to do rhinoplasties and facelifts. Like they know the face better than anybody, right? Mm-hmm. So I'm cool with that. And oculoplastic surgeons that are ophthalmologists can do around the eye stuff. Like I'm cool with that. But as soon as they cross the neck and they start doing boobs and tummies and you got OBs doing tummies, oh man, it's scary.
Here's where it gets scary. On the outside, everything seems fine because I have another example of another, unethical surgeon here in my own city who's a gynecologist doing tummy tucks and mommy makeovers out of his office. And he even coined himself, his nickname is even very for Hispanic women and Latin women. And on the flip side, I'm getting the calls of, he botched me. I'm looking at the pictures. I'm like, oh my God, how is this even a tummy tuck? Like what? So I'm seeing the repercussions of that dude learning how to do tummy tucks, because he came out the gate after deciding he's going to be a cosmetic surgeon doing tummy tucks, but he had to figure out how to do them. And all of those women are now walking around very upset because they thought they were going in to get a mommy makeover with the surgeon who was very qualified and could do it. And now they're realizing he was learning how to do it on them.
Yeah. And the other thing that's really interesting to me is when I got into plastic surgery and chose it, it was because I was enamored by all of the reconstructive stuff and the cosmetic stuff. So I actually did only reconstruction for a huge part of my practice, my first 10 years. And I still do some of it because I enjoy that. And I think it adds value to people's lives in a different way, and doing breast cancer reconstruction. And I do Mohs reconstruction when people get chunks of tissue cut off their face from skin cancer. Those are rewarding procedures. If you ask any one of these other cosmetic surgeons, would they or do they do any reconstructive work? The answer is no. Why? Because they're only doing it for the money. There's only one reason why those people are breaking their specialty and going into what we're doing, is because they just want to make money. Now, it's okay to want to make money, and I'm fine with that, but go back and do a plastic surgery residency. Go train, do it right, man. And then you're all in, like, do it. I'm cool with that. But to sell people short and not have the experience that you really need to treat the real life that is in front of you, that is a mom or a dad or a husband or a wife or a partner, whatever, a parent, they're real people, right? These are real people. And our obligation is to give them the safest, best operation we can. And when someone who's not trained or qualified to do it is doing it, that's where it gets really hard for me to accept these other people doing it. I'm okay if people are trained and they do the proper training and they've decided they wanted to go back and do it. I don't like the being shady and not being honest with people. None of them would ever say, oh yeah, like I'm a family practice guy, but man, I trained doing liposuction and that's what I'm good at, because they know that this first time they say that I'm a family practice guy, that the patient's probably going to be like, oh, well, this is probably not the place that I want to be, right?
Exactly.
So it's all about not being shady and not lying to people about who you are and what you are. I'm probably getting in trouble for saying all this stuff.
100%. No, it's something, trust me, every plastic surgeon I've had on the show has touched on this subject, on this topic, even a little bit. I know Dr. Macias from Marina Del Rey. He's like, just because it says doctor and surgeon on our certificate doesn't mean that the gynecologist should be doing tummy tucks, or just because it has surgeon on your certificate, if you weren't trained to do surgery, you shouldn't be doing surgery.
Did you hear about that lady that just went down to Tijuana to get a breast lift and ended up with a BBL and implants?
Oh my gosh. No.
Brings up a whole other topic. Like, there are excellent surgeons around the world. I don't doubt that. But man, you got to be careful.
You really do. And you know what, Dr. Brown, the same problem that we're having here, they're having in other countries like Mexico and Colombia, where certain doctors are picking up the scalpel when they shouldn't be. And it's not just a problem here for us, it's for everybody, which is even more confusing for the patients, because there's nowhere that they don't have to worry about that. They do have to be concerned about making sure that the surgeon that they're seeing is board certified in plastic surgery and not other specialties.
Yep. Sad.
So, okay, now let's talk about week of surgery. We're getting ready. This is it. My surgery's on Friday. Let's say surgery's on Friday. What should we be doing?
All right. You're getting your meds. You're making sure you have dressings. You're making sure you got all the things lined up at home socially, like meals for the kids, meals for yourself. Everything's prepared. You got your checklist. You have everything you need for wound care. You're thinking about getting the medications. You should be able to get your medications by them and have those at home. I would also be thinking about hey, let's walk through that morning. What is the morning of surgery like? Like, what time do I need to get up? Let's plan for traffic. Let's plan for all the what ifs. Is the tank full in the car or is the Tesla charged up? And you should be thinking about all the little things. What clothing am I going to wear to the surgery center? What am I going to leave the surgery? Am I center wearing? Am I staying overnight or not staying overnight? Do I need to pack a bag of things to bring for there? So those are all the little things you want to start walking through. What is that day going to be like? And I would try to do that a week out. And also checking in with your office. Hey, did you guys receive the lab work for my pre-op? Did you receive the history and physical? Because this is a big problem I'm sure you saw too. Man, doctors' offices are the worst at getting us their clearance. Like we could be 24 hours before surgery begging them for it after having begged for it for weeks on end, right? And they're busy too. But when the patient puts pressure on the doctor to get the stuff,
it's very different.
Well, it's a very different ballgame, right? When the patient's like, listen, I need you to get this over to their office ASAP, or I'm going to have to find another doctor. All of a sudden, they're like, okay, we'll get it done. So I think that you as a patient should be taking control of that a little bit and not just expecting your surgeon's office to receive all that stuff, because we try. But when you guys put a little bit of pressure on them for us, it makes it happen a little faster.
I like that because the patient calls and they get an answer.
Oh yeah, for sure. I'm trying to think of what else a week out they should be thinking about.
Let me tell you what I've seen, because when I help my one-on-one clients, like I have clients who come to me and they're like, hey, I want to have a mommy makeover. Who should I go to? Like, who's the best? And I walk them through the whole process. And in that process, one of the things that I do with them is I get the pre and post instructions from the surgeon that they're going to have surgery with. And I, in depth over a really long Zoom call, go over it with them line by line. This is what they want you to do. This is what they want you to do now. And so I get to see a lot of pre and post instructions. And what I've seen on a few of them is they're asking patients to up their protein intake the week of surgery. Like for 3 days before surgery, they're having them like start taking protein shakes, at least a couple a day. Mm-hmm. And I've also seen one I saw where they asked them to start taking vitamin C, like the emergency, like the week of, just to help their immune system that week of. And those are two things that stick out that I like to tell my girls.
Yeah, prior to my hip surgery, they had me taking zinc, vitamin C. They didn't really tell me to eat more protein because I already do. But yeah, they did have me on a few of those supplements. And, I think it's great to do that. I think it would be a great thing to do that beforehand. Do we have proof that it's actually going to help? It's just a little shady, but it can't hurt. That's what I tell people. Like, it cannot hurt to take a little zinc and vitamin C. It can't hurt to get a little extra good protein nutrition in your body. Like, none of that stuff's going to harm you. It can only help.
It can only help. Okay, Dr. Brown, I think we finally got to the day of surgery. We're ready. We have hit the finish line and now really started the real work, recovery.
Yeah. Yes.
Where the real race starts.
Yeah, this is the hard part, right? Like, so you show up that day, you're excited, you have your procedure, and now all of a sudden you're in a world of pain. It either is better than you expected or worse than you expected. So now what do you do?
Now it's hurry up and wait. Up and wait because now you're recovering. And that recovery, that first week of recovery, those hours are long. Those nights are long that first week after like a mommy makeover.
Yeah. I'm going to make sure I get you a copy of my book, The Real Beauty Bible, because I wrote my book. You probably saw. We're going to send you a free copy. It's literally walking people through this whole process, trying to give them an idea of what each thing's going to be like. So, little advice for post-op recovery, I would tell people. First of all, plastic surgery results are measured in months, not days to weeks. So you have to be prepared that you're not going to have that final result for a few months. I always tell patients, don't call the boob police for 3 months. Don't call the tummy tuck police for 3 months. Like, your shape and your contour is going to change tremendously over the first 3 months. So you should not expect that you're going to look completely snatched in the way that you want to look within the first week or two after surgery. And if you had a breast job and you had implants, they are not going to look normal for about 6 to 8 weeks. They're just going to look all kinds of messed up. And so people just need to be prepared for that. So I think having a little bit of faith, managing your expectations, realizing that recovery takes time is really important. Using your compression garments if they've been given to you, draining your drains, taking care of your incisions the way that your office is telling you to. Thinking about when you can start using scar therapies and things like that are really important. And then just having faith in the process. And the other thing I'll tell you is there's always going to be something that you're not happy with. And that's okay, because we're not perfect surgeons and no one's perfect. There's always going to be something that settles differently, or one side's a little uneven compared to the other side. It's hard to get perfect symmetry. I would urge people to try to give it time. 2-3 months out, have that discussion. Talk about whether, if things don't get better within the next few months from there, if there's something we could do to fix it in the office, or is this going to be something that needs a trip to the OR to fix, or do I just need to be more patient? But I know that for me, I see it all the time where people point out little things where I'm just kind of like, listen, scars take a year to mature. Like, we're not even going to touch that for 6 or 8 months. Like, let's just let it do its thing. I realize that's something that bothers you. I hear you. I'm not ignoring you, but just realize that if we jump on something too soon, we're not necessarily going to make it better. We could even make it worse, whereas it could just resolve over 6 or 8 months. So, but also finding your voice. And if something's really not right, trying to seek that clarification from your surgeon.
I think you touched on something very important, which is when you trust your surgeon, you made sure that you picked the right one. When they do tell you, hey, it's okay, it's going to look better in a few months, don't worry. If it's not, we'll take care of it. That peace of mind just alleviates that alleviates a lot of that stress and anxiety in the patient, because one, they believe you and they trust you that it's going to look fine. And they believe that if it doesn't look fine, you're going to take care of it. So that kind of relieves that pressure of, oh my God, it doesn't look perfect.
It doesn't look perfect. And also it's a money thing sometimes. People are like, if I have to go back to surgery. So I think it's important for you guys to understand your surgeon's policy about if you have to be taken back to the operating room and what kind of money is involved in that. Because look, every single one of us have complications. There is no perfect surgeon on planet. And I remember when I was in general surgery training, one of my surgeons told me, he was like, if you're not having complications, you're not operating enough.
I've heard that.
It means you're not wheeling the knife enough, because everyone has them. Even the best of surgeons have things happen, and we try to be there for our patients when those things do. And you just want to know that choosing the right surgeon doesn't always mean that you get the perfect result. It also means choosing the person who's stuck by you, that if something does happen, that even though it may not be perfect, they're going to do everything they can to make it perfect. And that's how I am. And I think it's just important to understand that we are not all perfect. There's a difference between botched and you had a complication, right? Like, complications happen. Botched is a whole different story.
Botched is a very different story.
That's a whole different thing.
Those women are, they're very dear to my heart, because it's so hard to have conversations where it's like, we can't fix this.
I know.
Those are some hard conversations to have. So I like to be as loud as I can, to warn and like, hey, make sure you know what you're doing. Make sure you're looking and you are exactly where you need to be before you put that deposit down and you accept that you're going to have surgery with this person, because some of those botched results they're repairable.
And you can never be 100% sure. So I want people to know that too. Like, you're choosing the surgeon that you think is the right person for you and who's going to do a great job. Look, it's impossible to know 100% if they're really the right person, but you've talked to friends who've been to the surgeon, you've seen their before and afters, you've sat in front of them, you have as much trust as you can. And then you just have to realize that surgery is surgery. It's not perfect. You can have complications. It's a risk. We all do what we can to mitigate that risk, but it's impossible to ever be 100% certain that everything's going to go perfect,
Absolutely.
But most of the time it does. And most of the time it does.
Yeah. So, Dr. Brown, I heard that you're also part of this doctor gang on Instagram that likes to pick on each other.
Me and Dr. Yoon. Yeah, we haven't really come at each other as much lately as we did earlier on TikTok. We do every now and then. It's time to start taking some digs. He's been bringing my friend, Dr. Subio, he's been bringing him into the fight a little bit too. But it blows me away that people actually think that we don't like each other. A lot of people don't think we like each other.
Oh my gosh, that's so funny.
And I'm like, you guys, it's a total joke. Like, we totally mess with each other. It's hilarious.
I love to see it. I think it shows a different side of y'all's personality, and it shows your potential patients a little bit about their surgeon. I think it would be so funny to have like a...
There's a patient I just saw a couple of weeks ago, and she DM'd me on Instagram, and she wasn't going to because, she was looking for a surgeon in Scottsdale, but she followed Dr. Yoon, and she loved him and she trusted him. And she was like, for sure that I was a bad person or not a good surgeon because of the way that he would come at me. Well, he referred her to me because I'm in Scottsdale and he knows me. So she DM'd me and she's like, oh my God, I thought that was real. Like, I thought if he didn't approve of you, like there's no way I was coming to you. And so he came to me for a consult and I saw him. We're going to operate on her. It's going to be great. We're going to do a great job. But she legit was like, I truly believed that
y'all hated each other.
Bad surgeon. I'm like, well, maybe we need to go back to acting school, right? The two
maybe y'all should just all take one group picture, everybody, even if it's remote.
Oh, yeah, totally.
On a Zoom call.
I think Tony and I should be the next botched guys. He and I should be the ones on the show botched. The problem is we both do body. He does face. I don't do face. But I think we would have a hell of a time having fun being on that show.
Oh, man.
Being the two surgeons, it would be so fun. We'd have a blast.
I would watch that. I think I would watch a reality TV show of all of y'all in your days.
Well, our friend Dr. Subio is probably the most comedic and hilarious one of everybody. If you don't follow him, he's amazing. I think, wasn't Dr. Galanis on your show recently?
Yeah, I had Dr. Galanis on the show.
So I'm in a DM with those guys. Me and a bunch of those guys for the past 5 or 6 years, we've had a DM on Instagram where we throw things back and forth, talk about cases, just talk about life. They're all good guys.
Tell them you were just on the show and that they need to get on too.
Okay, cool. I'll let them know. I'm sure any of them would love to do it.
Sounds great. Okay, Dr. Brown. So tell our listeners where they can find you online or in your office.
Okay. I got a lot of different places. YouTube is at Dr. Ricky. Go check that out. We just hit 900K on there. Crazy. And it's all short form, which is amazing. I have 2 Instagrams, but my Instagram that you should go to is Dr. Richard J. Brown. I'm sure you guys will link this. And from there, you can go to my Brown Plastic Surgery. Now, I want you guys to know that I've separated my Instagram pages. I don't show any surgical content on my Dr. Richard J. Brown because it gets shadow banned. So all my results and my surgical stuff is on Brown Plastic Surgery. Dr. Richard J. Brown is where I have fun, cut up, make fun of Tony, make good educational medical videos, some plastic, some not plastic. So you can hit me up there. And then on TikTok, it's The Real TikTok Doc.
I love it.
We have a Snapchat show too. Is it called Reshape? Reshape. We need some growth there. There's a Snapchat.
So send them over to Snapchat.
Yeah. Our Snapchat is at Dr. Ricky. I tried to change everything to Dr. Ricky, but someone owns it on Instagram and I can't get it.
Darn.
I know.
Okay, Dr. Brown, thank you so much for being on the show today. It was such a pleasure chatting with you, getting to talk about everything to get ready for surgery. We touched on so many gems of preparation and recovery. I can't wait to get your book.
Yes, we'll get you a copy. You got to send me your address and we'll send it to you.
And I'm going to send you my product. So I have a product that's a completely organic arnica balm. So they use it after liposuction, when they have a lot of bruising. It helps reduce inflammation and swelling, removes the bruises. Also works on old bruises.
Nice. So someone like after lipo, sometimes people get those weird bruises way out.
Yeah. The hemosiderin staining.
I'd love to check that out for sure. I want to tell your followers too, like you guys, DM me anytime. Instagram is usually the best place to DM me. And I try to answer people's questions and give them whatever they need. So if they need me, just let me know.
Awesome. Send him a message if you have any questions. And if not, I'll see you guys next week.
See ya.
So if you're listening to this episode and you're listening to the Big Butts No Lies podcast, you might be on your surgery journey. And if you are, and you don't know what to do, you don't know where to start, you've come to the right place. I am so excited to do one-on-ones with you guys. I've realized as I do them more and more just how valuable they are to you. Not only because you get my expert opinion, I get to guide you towards plastic surgeons that we know are going to do a good job and keep you safe. Besides all that, I get to talk to you about things that might not even be on your radar, things that you don't even know are possible. But since we get so in depth with our conversations and I really get to know what your dreams are and what you're really looking for with your body, I can tailor my recommendations to the surgeons that I know can help you achieve that. And taking the guesswork out of who to go to is invaluable. So schedule your one-on-one phone call with me. You can go to my website, go to the quick links, submit your information, let me get to know you. Let me see how can we help you. You can get your own team. You guys, I have been working so hard behind the scenes to come up with a perfect way for you to have your plastic surgery and not only come out with beautiful incisions, but also feeling beautiful on the inside. So book your call with me and take the guesswork out of your plastic surgery journey. And don't forget, new episodes every Monday. I'll see you then.